Hi, everybody. I'm Sharon Spurlock, the Senior Director of Family Education here at the St. Louis Arc. Welcome to our regular Tuesday Q&A. Um, Lots of times we have guests in from all over the community, but we also like to focus in on our own programs and really help families think about how they can utilize them to get their needs met and to make the most of the services. So I'm really excited that our topic today is respite. So without further ado, I'm going to turn things over to Amy Burnett and Sandy Vanderveer Irwin to introduce themselves, and they'll be sharing a little bit about respite services in general and how to utilize your respite dollars. So Amy, would you like to start?
Sure. Thank you, Sharon. I'm Amy. I am the program coordinator for the Arch Respite program. I have been in the respite program for the last 3 years, and I've been the coordinator or the administrative manager and coordinator for the last year or so. I also do a lot of other things throughout the St. Louis Arc with volunteering with our leisure programs. So you might have seen me on the basketball court with Arc United Basketball, or at the ball at Olivet Lanes as a program lead there on Saturdays, or bowling with the guys on Wednesdays. I've also done pickleball is what we're doing right now. And walking club is starting up as well. So you might find me at some of those places, or the dances at Dautel. I've also shown up there a few times.
Sounds like we might just run into you any place, Amy. And Sandy, how about you?
Hi everyone, I'm Sandy. I am the Director of Family Supports. I've been at St. Louis Arc for about a year. The Family Support Department has our Arch Respite Department, also Capable Kids and Families, our Family Navigators, and our Advocacy Program. It's a wonderful, wonderful department, very well-rounded, and we provide a ton of services just within our tiny but fierce little department here over at the Warson Building. Thank you all for being here.
So this is just an overview of our respite program, but we're also going to give you some, if you are part of our respite program already, give you some ideas of how to make your hours stretch throughout the year. So our respite program is short-term intermittent care, which allows a primary caregiver, which is typically the parent, time to de-stress, practice self-care, or refocus. We want to make sure that as a primary caregiver, you're getting the breaks that you need to be 100% when you're in that caregiving role. So similar to like on an airplane where you have to put your mask on before you put the mask on for the person that you are taking care of, that's what respite is for. Now, this program here at the St. Louis Arc is for St. Louis County and St. Louis City residents that have an intellectual or developmental disability living in their natural home. Intellectual or developmental disabilities are disabilities that occur in childhood prior to age 18, or in some cases age 22, that affect their potential for being independent adults in adulthood. So that's what we're looking for. You have to have a diagnosis from a physician that falls in the category of intellectual developmental disabilities. Some examples would be cerebral palsy, autism, epilepsy often is included. ADHD can be a diagnosis that would qualify, but we do have to have a specific notification from a physician indicating that they will likely be deficient in a couple of life areas as they move to adulthood with ADHD. Now, our specific respite program is a reimbursement model approach. So our families are expected to pay the respite provider on their own, report their hours to us, and then we pay the parent, and then the parent in order to reimburse what they've paid out to the provider. So it gives a lot of freedom for them to be able to choose their own provider, and that makes it a little easier for them to be able to use it relatively quickly versus waiting for staff. And that way our program isn't affected when there are shortages of direct support professionals in the social work field like there has been in the last few years. So luckily we weren't affected by that type of situation. But sometimes it is difficult to find providers even within your own network. Now, our reimbursement rate is determined by our funding source, which is a Productive Living Board of St. Louis County and Developmental Disability Resources of St. Louis City. A lot of our families do have to supplement that in order to get more skilled care. The reimbursement rate at this time is $10 an hour, but that does change annually. Now, there are some other respite programs within the St. Louis area, and they all run a little bit differently. Easter Seals has in-home respite provided by direct support staff that they provide. So if they don't have the staff, they can't provide the hours. They have been dealing with wait lists recently with their respite program. KVC Missouri has in-home and out-of-home respite provided by direct support staff employed by KVC Missouri. Sometimes they have put their respite on hold, and they are specific to children with autism. So if you have a different diagnosis than autism, or if your participant is not a child, then that one would not work for you. Oak Tree is an out-of-home respite facility that's run by United Cerebral Palsy. They provide the direct support staff, but they do have limited space. It's great for longer term respite situations, like you're going on a vacation, but it can be difficult to find space because they have limited number of beds. However, Oak Tree is specific to adults as well. So that is your option for out of home respite for an adult. And then if you are in St. Charles County, you would look into community living. They have a respite reimbursement model program similar to ours. And then there's also Pony Bird in Jefferson County. They have a voucher program. It's kind of like ours, not quite, and that's in Jefferson County. So those are the places that you can contact if you need additional respite that we can't provide. Now, there are some creative ways to stretch your hours out. First, network with other primary caregivers. Get involved with support groups, trainings, events at the St. Louis Arc or other events elsewhere throughout the community. And then you can trade off care. If you find someone that gets along with your participant, maybe another participant, then you can do meetups. And then maybe one time your participant goes over to the other family's house to spend some time and you get a couple of hours off, and then you trade off another time. With our program, since you can choose your own provider, as long as they are an adult that is not a parent, step parent, or guardian of the participant and doesn't live in the home, you can use them as a respite provider. So you've got that flexibility to network with whoever you want to, who can build a relationship with your participant. Sign participants up for other activities like clubs, classes, and camps. Now, you wouldn't report that as respite because you're not paying an individual respite provider for that, but you're still getting a break. If it's something that you can drop the participant off, that is giving you a mental break that you can spend some time doing some things for yourself. So take advantage of those opportunities. That's going to stretch out your actual paid hours that you would report to us here at the ARCH program, but you would still get that break and that rejuvenation that you will need to self-care. For older participants, depending on their abilities, you can give them ownership of household errands, and the respite provider can assist them with completing it. Think of like maybe you created your grocery pickup order and you would like to stay home and get something else done. Maybe you can have the respite provider take that participant out to the grocery store to pick up that order and run some other errands at the same time. Those kinds of things. If you don't have your own laundry facility at home and you need it to be done, you need someone to go to the laundromat, maybe have the respite provider take the participant to the laundromat. You can do other things for yourself at that time while they're managing that chore. They're learning how to do laundry, they're learning how to navigate the laundromat, and the respite provider is there helping them through that. So a lot of different ways that you can use it. You can include the respite provider on your vacation. Instead of leaving the participant with the respite provider for 5, 7, 8 days straight, offer to take the respite provider with you. They can still have some time on their vacation while the participant is spending time with you, but then there are also times that they can take the participant with them or spend time with the participant while you're enjoying yourself separate. So then your respite hours are going to look a lot like what they would if you were at home, a few hours here, a few hours there, kind of thing. If you have them with you, you can use them in a lot different way than if you have to leave them at home and use up 200 hours for that long, for that 4 or 5 day vacation. And for longer periods, if you do have to leave them at home, be mindful of when they're actually providing care. If the participant is still in a day activity or still going to school or has that camp or class or leisure program, and that respite provider is not actively there for that time, then you wouldn't report those hours. You would only report the hours where the respite provider is actually providing the direct care to that participant think about, does your participant really need a lot of direct oversight overnight? Do you need to report those hours? Or is that really going to be like the participant going to bed at 8 o'clock at night? The respite provider is going to have a few hours to themselves before they go to sleep. The respite provider might get up at 7. The participant might not get up till 9. You think about those kinds of things and report what actually makes sense for when the respite provider is actually providing care. So these are just some creative ways to stretch your hours out to make sure that they last all year. Our goal is to give you the time and opportunity to refresh yourself throughout the entire fiscal year. I mean, yes, people can use it for extended periods of time. We just strongly encourage you not to, because we want to make sure you are just as available mentally to your participant in the beginning of the fiscal year, which for us is July, as you can be at the end of the fiscal year in June. We want to make sure that every single month of the year you can be as good as you can possibly be for your participant, to make sure that your caregiving mind is in a good space.
Got bunches of questions. First, let me just say, I love that example about the laundromat, because I think it's such a win-win situation. When I talk to families, I always talk to them about, what does your family member want to get out of this experience? And what do you want to get out of it? Because so often you can do two things at once. Maybe they want to have a social opportunity without mom and dad there, and you're still getting a break, or they're going to learn a new skill and you're still getting a break. Our first question was about the vacations, and they asked if you had any tips for bringing the respite provider with them. Like, are there rules about what you'll pay for, lodgings, meals, or how do you know how to make a plan for that?
No, there aren't any official rules. We don't have any oversight on that. The respite provider is considered an independent contractor for you as the family. So that would be a discussion to have with them on what they would expect. You can invite them to come along. A lot of times we see where families will pay for the transportation there and back and maybe the hotel room, but that's a conversation to have. A lot of our respite providers are family members for the participant with disabilities, which is great in some ways. It can also cause some issues on others, but if they're family members, then they may be willing to pay for the cost to go there if you have specific times that they're going to be able to enjoy the vacation by themselves. So it's just a discussion. And that's one thing that we always hit really hard in our intakes when we have new families coming in, is that you really need to have the conversations with your respite provider on any type of situation. It's all about that positive communication. You want to have a positive relationship with that respite provider on the business side of things, to make sure that it doesn't muddy the waters of the relationship between the respite provider and the participant. Because the more contentious the business side can be, it's going to eventually seep into that relationship, and you want to make sure that that is as positive as possible.
Absolutely. Great answer. I think you're right that each situation could be entirely different. I could imagine you going on a vacation someplace where maybe I had a friend who I would want to stay with, but that I would still choose to come over and do some paid time with you as a respite provider. So I think it's really important to clearly spell out in advance what is expected of me as the respite provider and what are you going to provide for me, both directions. So, and then let us know how it goes, because we like to find out how that works. A couple of quick questions. Can a respite provider be located in a different state, such as Illinois?
Absolutely. We have a lot of families who bring in, like, a family member comes in the summer and watches the participant for a week while the family goes out on vacation. That happens all the time. Since we're not paying them directly and they're not employees for the St. Louis Arc, where they reside is not absolutely important to us. The most important thing is that we do need to be able to reach them, and they need to understand what the purpose is. We have to verify services that occur. We do this randomly, but we might randomly pick someone who lives somewhere else. In fact, we have one that we're working on now where the person actually lives internationally and came over for the summer to provide respite. And now we're having to send all of our questions via email because of the time difference. We can't actually reach them by phone. So there's a lot of situations that we have to consider. But as long as they are reachable and they understand that we may be calling them to confirm and ask some questions about the care they provided, then anybody is good as long as they don't live in your home and don't have that parent, step-parent, guardian relationship and they're an adult.
Here's a tricky one, I think. Can respite be used if I'm hospitalized and my family member is at home?
With you as a primary caregiver, yes, it can be used for that in an emergency situation. However, we don't encourage you to use that type of service because other services might be a better choice. There's other waiver services, which I know right now waivers are on a wait list. So if you don't already have a waiver in place, you might not be able to. But there's also something called personal care assistance that might be closer to what you're needing. So really, you need to be taking advantage of the navigation people that we have here from our family supports department or any case management you might have through the Department of Mental Health or Center for Human Services has taken over a lot of that in St. Louis County. So talk to them to see if there's other options available when you're hospitalized, especially for an extended period of time.
Yeah,
Wonderful.
Amy, I love that you mentioned that, and I wanted to kind of just briefly touch on a few things about that. We really do want to encourage everyone, if you have case management through Department of Mental Health, DDR or CHS or any of those, make sure that you are working closely with your case manager to access the services that you're eligible for, because those are your services. You are eligible for those, and they should really be accessed first. Our respite services should kind of be coming in as secondary, right? They are here for you. You are eligible for our respite services, but you really should be accessing all those other wonderful services that you're eligible for through the state. And then whatever's kind of secondary could be our respite services. And we are going to encourage that depending on certain situations. So that's kind of why Amy mentioned, if you do have a long hospital stay or something like that, we're going to kind of, make sure and encourage you to check in with your case manager if you have one or something like that, or get you in touch with one of our family navigators to help walk you through that process and find other resources that are more appropriate. Sometimes respite is not actually what you might need and what's not appropriate because it is short term. We like to say that it's like putting a Band-Aid on the problem, or duct tape on a leaky pipe, I said recently. And that's not really going to solve kind of maybe something long term that you're dealing with, because it is supposed to be short term. So that's why we want to kind of dig into what better supports we may be able to get you.
Fantastic.
Yeah, it does kind of go back to that definition situation. Like the definition of respite is it's really for your mental health to help give you that mental break. And you're not getting that mental break in the hospital, really. You're stressed about your own physical situation. So there's probably another service that's intended to be for that type of situation versus what respite is intended to be.
Absolutely. We have a logistical question that I want to make sure you guys address just about the total hours of respite someone is allowed per the county's guidelines, whether those are used with the ARC or with another organization. Similar questions here about what's the total, is there a total maximum dollar allotment? So can you talk a little bit about the caps on respite?
Sure. The Eastern Regional Alliance actually is a group of all of the funding boards that are in the St. Louis metropolitan area, including the Productive Living Board, Developmental Disability Resources. We have DDA in Jefferson County and DDRB in St. Charles, and all of them have a 504 unit cap. And that's for any of the programs that use their funding. So that's going to be all of them that are on the list that I provided are ones that use their funding. So if you are getting respite from the St. Louis ARC and you are getting respite at UCP, Oak Tree, that's 504 hours combined. So we are in communications with those other agencies when we have people that we know use both to make sure that they don't go over the 504 hours. It is possible to get approved for over 504. We don't do that within our program anymore. but some of the others might be able to, and it is an extenuating circumstance. It would have to be like that emergency type situation for them to consider it.
One of the first questions we had submitted was about how to find a provider if you've got really specific needs. If your family member has higher medical needs, higher behavioral needs, what are some creative ideas to try and really build those connections and find somebody that can meet your family's support needs?
Well, we suggest a couple of different things. Number one, asking nurses that are already at the doctor's office. Might already have a relationship with the participant. So anyone that works at any of the offices that are maybe the therapist's office, things like that, you can contact them and see what they say, see if they're willing. The other option would be to contact colleges specifically. Students at the college level that may be getting a social work degree, getting a therapy degree, getting a physical therapy degree, or any of those kinds of things that might be relevant to the situation. Contact those departments and see if the dean of that department might have some recommendations of students that might be interested, and work that angle.
We've had some families that have also used, especially for school-age children, former paras. I would never recommend using your child's current classroom para, because it's a lot of time with your kiddo, and you don't want them to be burnt out on spending that much time with your child if they're spending the school day with your child and then maybe other time with your child. But if the para from maybe the year before or from elementary school and now they're at the middle school, something like that, they've had a relationship. A lot of paras are 10-month employees, and so they're more than happy to have that extra income coming in throughout the school year. So I recommend that as well.
That's great. I'm going to just jump in here as well and say that I think one of the really interesting things to think about is where are the spaces that you are spending a lot of regular time. If your child is known at a church, at a local park, once you start to make connections with people, even if your child has really specific needs, you can start having those conversations about what your needs are and see if there's an opportunity, if there's a window opening or a door opening. I think it's really cool when families find a relationship at church where maybe their family member gets picked up and goes to a church service without them, so that they can get a break. And for that shorter length of time, sometimes that better accommodates somebody with really high support needs. You can use respite for a 1 hour if you've got somebody that's willing to do it for 1 hour. And I think that can be a really nice starting point for building up. And many times, like with anything, you're building upon successes. So maybe somebody spent time with them for an hour in a really controlled setting. Maybe they start to say, you know what, I think they could go to lunch with us afterwards. I think that would work out fine. Or why don't they just stay with me, because we're going to have this community gathering and we can extend this another hour or two. So, and that leads me into my next question, which is planning. I think one of the things we often find with families is that they wait until they need the respite and they don't really have a plan for what they want to get out of it, what their family member wants to get out of it. What can you talk about that for a minute?
I definitely would love, and Sharon, you can add to this as well. The Charting the Life course has their own kind of respite guide. We use the Charting the Life course tools throughout the agency. Some of you may have heard of it before. There are tools and documents that you can kind of think about what kind of good respite care looks like for your loved one. And kind of map that out and plan that out, and what a good respite provider may look like. You can definitely involve your loved one in that conversation. We were all about person-centered choices and things like that, and really involving your loved one in those conversations. So if you talk to your participant, your loved one, what do they want to get out of respite care? Is it meaningful to them? Is it going to be a new experience for them? Is it socialization? We have a lot of families that come in for respite care with their adult loved one, their adult child or their sibling who would love a respite provider that's similar to their age, that they can kind of go out and it's kind of like a buddy, to go bowling with or go have dinner with or something like that, because they're trying to build these skills of, especially after, I know everything is, we say after COVID now, but a lot of our participants and loved ones are still kind of dipping their toe into getting back out and into the world. And so this can be something you can absolutely use a respite provider for, is getting your loved one out and into the world. It may be just going for a walk, working on their physical health or their mental health or something like that. It's just a wonderful thing. And again, it comes back into your own self-care. It allows you this freedom to take care of yourself. It allows you to spend time with other loved ones that you have, whether it's another child, your spouse, your friends that you haven't seen. You told them you were going to see them and now it's been 6 months, whatever it may be. So you can really be intentional and plan for those things. Yes. So not only having a list of providers, but then planning about what respite looks like and talking to your provider about, this is who my loved one is. These are their likes and dislikes, really letting that provider get to know your child. Something else we talk about in the intake is you can do kind of a test run of a respite care night, right? Or evening or time. And you can still submit that for reimbursement. So let's say this is somebody new, a new provider that you're going to use. It's maybe not a family member or a friend or someone you know really well. Have them come to your home for an hour or two, be with your loved one. And maybe you're just in the other room reading a book or something or watching TV, but you've got an ear out, right? You're kind of listening to see how they're interacting with your loved one. This isn't probably care or a respite for any of you, but maybe you're doing the dishes. I don't know. Maybe some of you all that's respite for you, but you're just close by, right? Just to see how they get along, right? You're more than welcome to submit those hours for reimbursement, because you do have to kind of test it and see how they get along with your child or your loved one. So that's always something that we recommend to people, because you want the right fit for your family.
And that's also a way to get a skilled provider. Yeah, you may not have someone that has the skills walking in the door, but you may be able to train them on the skills that are necessary to interact appropriately with your participant.
That's a great
Well,
point.
Amy, that leads me right into this next excellent question we've got. Do you have interview tips for finding the right provider?
We do have resources available that we have on our respite portal for our families to be able to access. But I do know, like, the first time that I would talk with a provider, in my opinion, or the first time you're going to introduce them to a participant, go somewhere where the participant is happy. Like if you've got a kid that you will have a ton of fun at a McDonald's play place, take them there, have the respite provider meet you there, have them interact with a participant in an environment where the participant is 99% going to be happy, and see how they interact and start that. You do need to ask questions about what they expect to be paid. You need to ask questions about their availability, what type of experience they might have in that type of field, or even if it's not in, like, specifically in the field, if they've been around people with disabilities in any other way. A lot of people who work in social services grew up knowing someone who had a disability. So if you find someone that has that type of experience, then it may be worth digging in a little bit more. But, truthfully, most of the time it is a gut feeling that puts you in the direction of the right person.
Yeah. I think you can also, if you know your family members' likely behaviors or likely areas of concern, you can craft some open-ended questions about that. What would you do if
Scenarios. Yeah.
if they refuse to eat, if a person refuses to eat? What would you do if somebody yelled all the time? What are your strategies around that? Because even people without a lot of experience, you're going to learn if they're creative problem solvers and kind of what their general approach to handling those situations are, which I think are good. And we can offer you some guidelines, but those are really good starting points, I think. Um, we have one last question in the pool, and then I'm going to let you guys wrap up with anything you want to make sure we talk about, Amy and Sandy. The last question is a little bit nuanced too. There are some places around town that do drop-off respite. Some of them are agencies like the St. Louis Arc, and some of them are just mommy and me. So if it's a mommy and me situation, you don't have to report those hours because it's not coming through your SB 40 boards. Do you know if the drop-off respite that's provided by other disability agencies, is that coming from the same funding pool, or is that totally separate?
It depends. I know that Easter Seals had a drop-off program. They still have a drop-off program, but it's no longer counted as respite. That's separately funded now. So it doesn't count towards respite hours, but it used to be up until last fiscal year, I believe is the first year where they started transitioning to where it wasn't counted as respite hours. I do know that Oak Tree drop-off is respite hours. But it all depends. The easiest way to find out is to contact where you're dropping them off and ask them who funds their program. It will most likely be on their website as where their funding comes from. And on their website, they'll have the emblem of the Productive Living Board or Developmental Disability Resources if it's one of the ERA funded services. Or it might say that it's funded through somewhere else. Most of that information is available on each agency's individual website, or you can call them directly.
Fantastic. Thank you so much. This has been really informative. I think people got great ideas today. Sandy, is there anything that you want people to walk away and think about that we haven't talked about today?
We know that, caring for a loved one, is very rewarding. But we know it's stressful as well and overwhelming. And so we're proud to be able to offer this service for you all. And if you ever have any questions about anything, please feel free to reach out to us. And again, we have other supports here. We're very fortunate at this agency to not only have the respite program, but to also have so many other staff that can support you in other ways to get you other resources. So, please feel free to reach out, to call our main number as well. And we can get you in contact with other services and other supports. And something that I love about the ARC is that if we can't provide you what you need here at our agency, we will find, another agency within the community that can find you what you need as well. So,
Well, as Sandy said, the same thing, like we can find you another agency. We've also helped respite families find respite in other states if they've moved away. So if we can't service you because of where you live, just feel free to ask us the question and we will try and find where we can send you to so that you can get that help that you need elsewhere.
Fantastic. There it is. We're here to help when you need it. So let us know. If we can't do it, we'll certainly find the right space. So thank you guys for coming today and talking about what families often tell us is the most important service that they are receiving if their family members at home in home respite. Bye, everybody.